Shukran, Dr. and Excellency Bandar. Good morning, good afternoon, good evening, everyone, from wherever you are in this small world. It is a pleasure to be here, and it is from WHO perspective, we continue to focus on solidarity to fight the pandemic. Let's remember that this is not just a public health pandemic. It is not the COVID-19. It's not only a public health pandemic. It is economic. There's economic impact. There's a social impact in addition to the public health impact. And due to that, global multi-sector partnership and collaboration is key. Or in other words, we need stronger solidarity. But also, let's remember that the public health sector is not very advanced in the digitalization compared to sectors such as media, financial sector, insurance, education, and others. So we still have a long journey to ensure that the digitalization or the digital transformation of the healthcare sector is accelerated to make sure that as we go through this very first pandemic in the digital era, we actually leverage on those digital tools and digital solutions to bring about less suffering, less death, and really take advantage of the digital technologies to advance issues such as early surveillance systems, health system strengthened, in addition to vaccine therapeutics and diagnostics. At WHO, we have the Access for COVID tools, which is a global partnership, and we hope that all the global initiatives and collaborations and partnerships, they lead us into one specific outcome, which is an outcome where, first of all, we do better next time. Second of all, we minimize the impact on our socioeconomic and health impact in current pandemic. And also, we have to do better than what we do in, for instance, weather forecasting. We need to do better on disease surveillance systems to ensure that we are able to minimize the impact of these pandemics. Now, as we fight the pandemic, and as we go through preparedness, surveillance, response, and recovery, there are three areas that we need to make sure that at this stage, it needs to work hand in hand. So from one end, the public health security, where we see the work of public health response to COVID-19 at national, subnational, and global level. We need to also look at the digital solutions, both on epidemiology, but also on digital epidemiology, health data management, and all the issues that perhaps we've been not giving sufficient attention in the past to accelerate that, to make sure that we really succeed and we really minimize the impact to the whole world on diseases such as COVID-19. The third area is cybersecurity, ethics, and privacy. So a trusted ecosystem or trusted digital health ecosystem is key. So we hope that with that collaboration, and at WHO, we have the Global Digital Health Strategy, which is going through the approval of our member states. We build an ecosystem that is trustworthy, it's ethical, and then it adheres to privacy issues. And I know it's easy to say, and it's a journey to get through, but nothing in this world, if we are determined, there's nothing in this world that can stop us from creating a safe, secure, and ethical digital health ecosystem that delivers public health impact and health outcomes, positive health outcomes, to ensure that we better manage diseases and pandemics such as this one. On public health security, of course, there's the many countries and whole world, as Excellency Dr. Bandar mentioned. We're trying to bring innovation, mobilize sectors to control case, suppress transmission, reduce mortality. So and we are learning the virus, the technologies, and the innovation that is needed to do that. On the digital side, the population and patient care in using digital solutions is key. And for that, we need to make sure that digital solutions are an integral part of public health response, not another silos. The public health and the healthcare sector has been working in silos for many, many years. I think it is time for us to bring the integral solutions, but also making sure that we create an interoperable ecosystem that really brings benefits and public health benefits, as well as positive health outcomes for the global community, especially using digital solutions. So we hope with the G20 presidency from Saudi Arabia, we can initiate that journey together with multiple stakeholders. Now, by preserving data privacy and security, it's key. We see health data as part of, health data should benefit and enjoy similar principles as human rights, to ensure that on one end we protect the privacy, but on the other hand we also ensure that sharing data for benefit of health, to ensure that this principle of creating a donation as we donate organs in health and life science, but also ensuring that there's no abuse from monetization of data. We need to strike that balance where privacy, data security, and ethics work hand in hand and bring those needed benefits that we all want to see. With this, I want to just thank Excellency Dr. Bandar, but also thank all the participants that joined this global digital health summit to take this challenge of the new normal post-pandemic requires a new normal of working together. And that new normal of working together requires multi-sector partnership, requires every one of us, both private sector, public sector, academia, civil society, to the United Nations, to bring the best of us to really reduce the impact of the current pandemic, but also do way better next time. Thank you. Shukran.